Where are breast augmentation incisions typically placed? When considering breast augmentation, one of the key decisions is where the surgeon will make the incision. The location of the incision plays a big role in how the scar will look and how the surgery proceeds. The most common sites are carefully chosen to balance aesthetic results with safety and healing. The first and most frequently used site is the inframammary fold, which is the natural crease underneath the breast. Making the incision here allows the surgeon direct access to create a pocket for the implant, making it easier to position the implant accurately. Because the incision is hidden in the fold, the scar tends to be well concealed by clothing or the natural breast shape. This approach works well for both saline and silicone implants and is associated with a lower risk of complications like infection or capsular contracture. Another common site is around the areola, known as the perioral incision. This involves making a small cut along the lower edge of the darker skin of the areola. The scar blends into the natural border of the areola, making it less visible. This approach is often chosen by women who might also want a breast lift or prefer a less noticeable scar. However, it does carry a slightly higher chance of affecting nipple sensation or breastfeeding ability because of the proximity to nerve and milk duct tissue. There is also a small increased risk of bacteria exposure from the breast tissue, which can influence healing. The transaxillary incision is made in the armpit, which keeps the breast itself free of scars. This method is popular among women who want to avoid scars on the breast and prefer a more discreet approach. It is usually used with saline implants, which are inserted empty and then filled once in place. This technique often requires an endoscope to guide the placement, and while the scar is hidden in the armpit, some surgeons feel it offers less control over the exact positioning of the implant compared to other methods. The transumbilical approach, or transaxillary, involves making an incision in the belly button. This method is only suitable for saline implants because the implant is inserted through the navel and then filled once inside the breast pocket. The main advantage is that the scar is hidden in the navel, but it is less commonly used today because it offers limited control over the final implant position and cannot be used with silicone implants. Choosing the best incision site depends on many factors, including the type of implant, your body shape, aesthetic goals, and personal preferences. A board-certified plastic surgeon will evaluate these factors during your consultation to recommend the safest and most effective approach. Remember, all surgical incisions will leave some scar, but modern techniques aim to minimize their visibility and promote good healing. Always discuss your options thoroughly with your surgeon to ensure you understand the benefits and potential risks of each incision site.